Turning now to the vaccination efforts across the country, Rhode Island health officials are still discussing whether to resume administering the Johnson & Johnson vaccine again.
As we reported late last week, federal authorities have given the single-dose vaccine the green light once again. 12 News reporter Kayla Fish joins us now live with why Rhode Island is proceeding with caution, though.
Well, while Massachusetts and Connecticut are beginning to distribute the single-dose shot once again, Rhode Island officials are still hitting pause, at least for now. Over the weekend, a spokesperson for the Rhode Island Department of Health told 12 News the state will be making a decision sometime this week on whether to resume use of the Johnson & Johnson vaccine. Friday, federal authorities voted to end their pause on the shot, one that was prompted by reports of a handful of people developing a rare but dangerous blood clot after getting the J&J vaccine. Before that pause, the J&J made up about 5% of total doses administered in Rhode Island. A spokesperson for the Department of Health tells 12 News that the state has enough Pfizer and Moderna vaccines that holding off on the J&J isn't impacting vaccination efforts. And while some say pausing the Johnson & Johnson vaccine may have done more harm than good, in an interview over the weekend, Dr. Anthony Fauci said the pause and discussion around the vaccine showed officials take safety seriously.
So if anybody has any doubts about the safety of those other vaccines, and including J&J, we can now say, you know, we take this very seriously. We've looked at it. Now let's get back and get people vaccinated. And that's what we're going to be doing.
Now, there's also a push to resume the single-dose J&J shot because millions of people are skipping their second dose of the Pfizer or Moderna vaccine. A new report in the New York Times shows some did so because they feared the side effects, or they thought they were thoroughly protected with just one dose, or because they couldn't make it to their follow-up appointment. Now, that last reason is why some, including the dean of the Brown University School of Public Health, are calling the one-and-done J&J shot a potential lifesaver and pushing for it to be administered once again. Live in studio this morning, I'm Kayla Fish, 12 News.